What's up, guys? Welcome back to Jane's Lane. So today I wanted to come at you with a quick video with 5 tips for new grad nurses or new to specialty nurses. But before we get started, please like and subscribe for more content like this. Let's get started. Tip number 1, come prepared. Do not underestimate the power of preparation. So if you're going to be driving to your first job, know where you're going to park. If you're going to be taking transit, know how the transit system works and how you're going to get there. Come prepared with everything that you will need. So that includes scrubs, appropriate footwear, pens, pencils, highlighters, your stethoscope, your ID badge, a pen light, your lunch, snacks, coffee. Whatever you will need to get through the next 12 hours, you need to bring it. So the power is in the preparation, so you got to be prepared. That's tip number 1. Being prepared leads me into tip number 2, familiarize yourself. So get familiar with the hospital, the unit, and just the nature of the job in general. So you want to know the general layout of the hospital. Where's the lab located? Where are different wings located? Where are the visitor elevators located? You know, sometimes you'll be strolling down the hallway, you might have somebody ask you, excuse me, where can I find the cafeteria? It's just good information to equip yourself with. So familiarize yourself with the general layout of the hospital, but also familiarize yourself with the layout of the unit. Where are your emergency exits? How many rooms are on the unit? Is the unit set up in such a way where you have, acute patients on one side and subacute patients on the other side? Familiarize yourself with that too. You want to know, where's your supply room? Where's your med room located? Where's the nursing station? If you're in a paper-based charting facility, you want to know, where do they keep the charts? Familiarize yourself with the patient rooms as well. Where can you find the code blue and the code white button? You don't want to be in a situation where you're looking for the code blue or code white button when something has gone wrong. It's just going to waste time. It makes you more frantic. Where can you find your emergency equipment? Where's that in the patient rooms? Also, familiarize yourself with the patient beds. I know in these newer facilities, they have these state-of-the-art beds that can do so much. They have so many features, so it's good to know what these features do. But I would say the most important feature on all these beds that you need to know, and you should probably learn that on day 1, is where you can find the CPR lever. Pulling that lever is going to flatten out the bed from whatever position it's in, and it will put the patient in a position where it will allow you to administer CPR. So you really want to familiarize yourself with that too. And I just want to say that familiarizing yourself also includes equipping yourself with knowledge about the unit that you're going to be working on. Do your research. Research common medications, treatment, diagnoses that you're going to see. If you're going to be starting on labor and delivery, it would do you well to look up common medications that are given during labor. What is postpartum hemorrhage? What are signs of postpartum hemorrhage? How to perform a fundal massage. Going into your first job with this knowledge, it's just going to make your life so much easier. And when you're working in real time and you see these situations and you see these drugs, these treatments, it's not going to be your first time seeing it. It's not going to be brand new. Granted, you are new, so give yourself a little bit of leeway where many of the things you will be seeing for the first time. But if you research before and you familiarize yourself with, like I said, common treatments, diagnoses, medications, then you'll give yourself that leg up and that'll do you good in the long run. So that was tip number 2, familiarize yourself. Tip number 3, ask questions, observe, and volunteer. Guys, there is no such thing as a stupid questions, especially as a new nurse. So ask all the questions. If you don't understand something, ask. If you don't know how to do a blood sugar, put your pride to the side and ask, because I promise you, everybody was once new. We all learned how to do it. So if you don't know how to do it, just ask. You want to observe. If you know that the patient in room 17 is going to be having their PICC dressing change later in the day, ask the nurse if you can watch how to do that. If you know that the patient in room 2 needs a Foley, ask the nurse and the patient, hey, can I put in this Foley catheter for you? Can you observe me put in this Foley catheter? But of course, this is after you've assessed your own knowledge, skills, and comfort level with performing that procedure. Volunteer to do it. This is the best way to learn. You want to put yourself in a position where opportunities for learning just come to you, because that is the best way to learn, not only as a new nurse, but even as a seasoned nurse. Like, I've talked to nurses who have been working for 20 years who tell me that they learn something new every day. Nursing is a career where you learn something new every day. So it's best to go into your first job with that mentality. Ask questions, volunteer, observe. Tip number 4. Be patient and slow down. Guys, you just graduated nursing school. This is your first job. In my opinion, nursing school does not teach you how to work as a nurse. Nursing school will teach you how to pass your licensing exam. So when you know that, just be patient with yourselves and slow down. You have the theory, you have the knowledge. You know why a Foley catheter is going to be inserted, but knowing how to insert a Foley catheter, knowing how to manage any complications that come with that, knowing how to document, those are things that are going to come as you work on the job. They're going to come with time. So you got to give yourself that time to learn. I know it can be daunting because you're rubbing elbows with some of the most brilliant minds in the hospital. You're working with nurses who have been on the job for 10, 20, even 30 years. And this can make you feel intimidated. But I promise you, everybody there was once a beginner. Everybody there was once in your position, even if it doesn't feel that way. So be patient with yourself. Slow down. Everything will come together in due time. Slow and steady always wins the race. So do not rush this. Slow down. Tip number 5, lean into your self-awareness. Know yourself. Know your strengths. Know your weaknesses and work on both. Socrates said, an unexamined life is not worth living. The same can be said here. An unexamined nursing practice is not worth practicing. You got to take stock of your day. You have to get comfortable with self-reflection. You know, at the end of your shift, you need to be asking yourself questions. What happened today? What went great? What could have gone better? What did I see that I had never seen before? What medications came up that I had never seen before? This is the best way to learn. Self-reflection is the best way to not only learn about yourself, but it's the best way to learn about your job. The sooner you can get into the habit of self-reflecting, the sooner you can build and strengthen this muscle, the sooner you will feel more comfortable as a nurse. So self-reflection is the key. Lean into your self-awareness and work on that. And guys, I have an unofficial tip, if you will. It's a bonus tip, and it is learning to say no. I know as a new grad, you want to be eager to show your manager, to show the team that you are a team player. Before, I did say ask questions, observe, and volunteer, but that doesn't mean volunteering to stay late. That doesn't mean saying yes to every shift. Every time they say, hey, can you stay till 9:30? Can you stay till 11:30? We're running short staff. No. Learn how to say no from early. If you say yes to everything, that's a surefire way to increase your chances of burning out. And you want to avoid burning out, especially as a new grad. So learn to say no, advocate for yourself. This is a muscle you need to work on. The more you say no, the more comfortable you'll be with it. And with anything in life, the more you do it, the easier it will come. So that is my unofficial bonus tip, learning to say no. And there you have it, guys. Those are 5 tips for new grads and new to specialty nurses. I hope you like this video. I hope after you watch this video, you feel a little bit more calm and your mind is just a little bit more at ease in knowing that everybody was once new, every expert was once a beginner, but the more you do it, the more comfortable you will become. And before you know it, you'll be walking into your 12-hour shift confident with your head held high, knowing that I can handle anything that is thrown at me. I want to see what you guys have to say. I want to hear any tips and tricks that you guys have. Do you have any suggestions? Please leave it down in the comment below. And again, please like and subscribe for more content like this. Thank you for watching, and I will see you in the next video.